Right, so what are we going to talk about today? On my agenda, I want to start off with just some causes around infertility. Maybe if you're not really always working in the field, or it's just really a recap. So to think about all the things about what would be struggling to fall pregnant. We also then will focus a lot on fertility screening solutions. So what are the type of screens that you can do? And of course, my main focus is going to be on the 3x4 genetic test, which is where my expertise. And of course, we have to then teach you some treatment solutions. So just as an introduction, thinking about fertility. So there's many reasons fertility is impacted these days. So in 1970s, people were having more between 3 and 7 children. So that was the total fertility rate. And then it dropped lower. It actually halved by 2014. And then by 2024, it's dropped even more. I don't know how you have 2.5 children, but that was the statistic. And so the World Health Organization says that 17.5% of the global annual population, and that's 1 in 6, struggle with fertility. And in the USA, the numbers I got was 9% in men, 11% in females. So that's quite a big percentage if you think about how many people who are wanting to fall pregnant are struggling with it. And just in terms of how the fertility rate is dropping, or not the fertility rate, but the amount of children people are having, they say if it carries on like this, by the 21st century, the population would have shrunk quite substantially. So let's start with some primary or some causes, the causes of infertility. So this is really just a lovely overview. So we think of our primary pathologies. So this is around sterility. So in males, what would happen is there would be some sort of disruption in spermatogenesis, and also maybe some abnormal sperm. And here you think of things like male accessory gland infections or some sort of inflammatory conditions. And in females, we have many reasons for ovarian insufficiency, and then also if there's fibroids, polyps in the uterus, that could impact fertility. So those are our primary pathologies. Then thinking of systemic pathologies, PCOS way up there. And then, of course, in both genders, we're thinking of diabetes and kidney disease that would impact it. Then going over to the middle here, when we think about genetic variations. So this is what I will talk about mostly today. But just as introduction, insulin regulation, melatonin production, that's a lot of information about how melatonin or the deficiency of melatonin impacts fertility. Then in terms of more upstream processes, we have oxidative stress, inflammation, and methylation. Then also thinking of clotting factors, histamine breakdown and hormone regulation. We'll go into those details, and never forgetting the environmental and lifestyle factors, of course, impacting why people are not getting pregnant. And then also maybe things like age, people have children later, economics, the psychological impact, anxiety and depression, and so on. So just focusing a little bit more on the female infertility. So we have the primary ovarian failure, any sort of ovulation disorder, autoimmune conditions play a big role. Like I said, PCOS being quite a big topic, and then hormonal imbalances. And when it comes to male fertility, like I said, so the 3 things we think about is sperm, the shape of the sperm, the morphology. So that is going to impact it, the motility, how it moves, and of course the sperm count. And the things that would impact these different features of the sperm would be the presence of infections, autoimmune conditions such as celiac disease, for instance, will be associated with infertility. And sometimes that's when you discover that condition when you're starting to do the testing. And also tumors, of course, and iron overload is also something that's often missed and is associated with infertility because of the oxidative stress. We'll look at that a little bit more, of iron overload and how it impacts the sperm. So let's start with some more solutions, thinking of what are the things that you can do in terms of solutions. So we know that all these things I've mentioned will play a role always, it doesn't matter what you screen your patient for. And we are thinking now more about what you can do. So if you start off with maybe a genetic screen and maybe knowing more about the types of genetic screens you have, that will help you to take preventative measures. Maybe if you start early with these screens, you don't wait till there's more problems. So that could also be done at any age. But of course, if the person is coming to you for fertility, you can have some more targeted testing and targeted diet and lifestyle recommendations. So if we think about genetics and fertility, this is quite a big number. So we always want to know how much is associated with genetics, and more than 50% of infertility can be due to genetic factors. And of course, this is not just directly, this will also be, if we think back on my slide, the comorbidities that play a role. And so you could have single genetic influences, but often they're polygenic, so it's a bunch of genes that impact it. And here, for instance, sterility can be sometimes a single gene. So if we think about just thinking a little bit about the genetic lens, or what sort of things are available. So the types of prenatal and genetic screening. So you have fertility and perinatal focus tests, and these are nutrigenomic tests. There are a few out there, and this is what the 3x4 test will be. It's a nutrigenomic test. But there's other tests as well. You can do pre and post implantation genetic testing, and here you more do things like test for chromosomal abnormalities, for instance, Down syndrome. So this is from an article. I just recreated this infographic to make it a little bit more colorful. And so if we think about why, when, and what in terms of genetic testing, in the first little block here, we think about just identification of infertility causes. So if somebody comes to you and they want to know if they have some sort of genetic impact here, we want to know what are the genetic causes, and also if there's any genetic diseases that you can transfer to the offspring. This is done pre-conceptual age, and the samples are normally taken obviously from both parents. So this is before you even go to any more fertility treatment. Then the second group would be identification of genetic diseases that can be transmissible to the offspring. So here we think of monogenic diseases, structural rearrangements of the chromosome, and aneuploidy, which just means abnormal chromosomes. Then this is done at periconceptual age, and this is an embryo biopsy. And then lastly, we have the optimization of the assisted reproductive technique. So if somebody's already pregnant, there are tests available, again, screening for the chromosomal screening, and this is also done prenatal, so while the pregnancy is ongoing. And here we have samples of the mother, or you can have chorionic villus sampling or amniocentesis. And then at any of these steps, this test, the nutrigenomic test, such as the 3x4 test, will always be useful to be able to support whatever is going on. Of course, if there's chromosomal abnormalities, that's a different case. But sometimes all these tests are done, there's nothing that came up, then this test will always be useful for perinatal support. So just some interesting things here. So karyotyping is done in both male and female for the sort of more genetic screening. And there are many genes but they are quite rare. The most common ones in females is Turner syndrome, where there's one of the X chromosomes is missing. And you also have Klinefelter syndrome, which we have two X's and a Y that you can see in male and female. And in males, you can also have things like Jacob syndrome. So these are the most common reasons why for infertility when these chromosomal tests are done. This is just an example of what it looks like. This is called a tri-screen, and this is where they screen for. This is a company that screens for many of these chromosomal abnormalities, and this is in the offspring. So just so you know what it looks like. So why do we want to look at genetic variations? And so it's really about looking at how we respond to the environment. So here I'm moving now to thinking of a nutrigenomic test. So when we talk about responsiveness, it means that what you want to know about someone, how someone will also respond to your treatment and interventions so that you can be more targeted. And at 3x4, we don't need to map the whole genome. We have insights from metabolic and biochemical processes. And then by looking at these gene variants, it will help us to make specific recommendations. And we have this pathway-based approach. So this, if you haven't seen our test before, this are a few pages of the report, and I will go into more detail. But just so you can see, we screen around 171 gene variants, and then they are arranged in pathways. These are all color-coded, and that helps you to go to the places where there's the most genetic impact. And then we've got these infographics, which is there for the practitioner to engage with your patient so that you don't have to scribble a picture on a piece of paper to explain things, what's going on in cellular health or systems and so on. So there's 36 of these metabolic pathways. So the 3x4 blueprint is not diagnostic, so it's not the same as the other tests that I mentioned where you're really looking at more upstream or more monogenic problems or chromosomal problems. This is really more for health insights, and the majority of people will benefit from this rather than going to the other testing, but sometimes that's the first screen you want to do. So the pathways and the SNP information can then be used to support the fertility in both genders, so male and female, because both are important. Then that will also help to support a healthy pregnancy. So once there's a pregnancy, that can be supported, and of course a healthy baby. And then even postpartum, we want to think about postpartum resilience. And so this report has got a lot of information which can help you with all these different stages. So if we're thinking a little bit more about what I'm talking about here, so your parental health, you will optimize your male and female health during all the stages, pre, during, and post-pregnancy. Resilience, so support the mental and physical resilience. We want to prevent the complications during pregnancy, things like gestational diabetes and preeclampsia. Optimal weight gain, always important. Hormone balance, so that will be for both men and male and female, and the fetal health to just create this optimal environment for a healthy baby. So going back to the responsiveness, so when we think about genes, we know that genes don't change, but our environment can change. And every time something happens in your environment, if you eat something, if you're exposed to something, they are impacting our gene expression. So we often think of your epigenetics like switches. So everything in your environment are going to switch these genes on and off. And like I said, every time you're exposed to something, these are some of the epigenetic factors that we think about. So when we think of epigenetics, it's the environment outside the gene. So when we do the genetic test, it really gives us a little bit of an insight on where we want to start. It's not to say that we're only going to do that, but you always want to start at the most impactful place. And that is where genetics come in, because it will always help you to get rid of some of your blind spots. Okay, some more pages of the report. So this is just so you can see this is how the genes are color-coded. The genes, we give you information about every gene. And this is also, we have a platform where you can read more about every gene. But there's no way you're going to be needing to know obviously the genes that impacted could be at least 100 genes. You don't have to try and interpret every gene. We arrange them in these pathways, and then it's color-coded, and that will then help you to see where the highest impact is. Okay, so I'm going to go through some of these pathways. So starting on our cellular section, we have inflammation, methylation, oxidative stress, and detox in these pathways. And stress and inflammation, these are tools just to sort of explain, there's a vicious cycle between oxidative stress and inflammation. And this picture on the side here, all these little blocks here are the gene variants that we test, and that helps us to see every part of the inflammation process and where the genetics are. But if there's high impact in this pathway, that is something you can focus on with your patient, and we know how much that would impact fertility. And so thinking about this, so uncontrolled, so inflammation really impacts fertility risk in both genders. And if you have uncontrolled inflammation or chronic inflammation, it will promote estrogen dominance, and that will impact implantation and also can contribute later to pregnancy outcomes. So inflammation would be associated with inadequate ovarian reserve. You have poor endometrial receptivity and also poor quality embryos. And so that is what we think about in female fertility. And of course, there's other factors over here which will also impact like stress and so on, which will also add fuel to the fire. And of course, if there's a high genetic impact, that will increase the possibility of inflammation. In men, also inflammation and oxidative stress fuels the gene variants. So we know that oxidative stress is really important for the health of the sperm. So if there's high oxidative stress, either from the environment or from a genetic point of view, you will have increased lipid oxidation, you can have DNA damage to the sperm, and also protein oxidation. So that will mean that you have this altered biofunctional sperm parameters, and often you will see low testosterone. And when the testosterone is low, that's also associated with increased inflammation. Moving on to detox. So detoxification, we have the two phases, phase 1 and phase 2 detoxification. And again, so don't try and read all of this. This is just to give you an idea of all the gene variants that we measure in our detox pathway. And so in your phase 1 is when your toxins are hanging around as these intermediates. And if you have a lot of genes that are impacting this process, something like endocrine disruptors, for instance, can play a bigger role. And then in your phase 2, when these transformation process takes place and these intermediates are transformed into water-soluble waste and excreted, the SNPs can also be associated with unexplained fertility issues and poor outcome, even things like low libido. So this was just an interesting study that I found. This is one of the genes we test, the EPHX1 gene, and this is also the variant we test, which has got 1051740. So remember, when you want to read about a gene, always make sure that or the SNP of the gene, which is the one that's tested, make sure that it's the right RS number. And this was a group of women, and they had consistently seen low birth weight infants and low iron levels because these women were exposed to toxins in the environment when they had this gene that was consistently seen. So moving on to methylation, I probably should have started there because we know methylation is talked about a lot, and that is so important. Although I think these cellular pathways are all important. But in our methylation pathway, again, this is quite a busy slide. All of these enzymes are part of our methylation pathway, and that helps us to see that where the bottlenecks in the methylation processes. And also thinking about choline, so that's also part of the salvage pathway here, and we have genes that impact the need for choline from the diet, and it's so important in fertility and for brain development. So I just wanted to show you when we look at the pathways. So in our test, you have for each pathway, there's a bunch of genes that are color-coded. And this is just an example of four different patients and how the genes will be different in the pathways. So you'll be able to see what genes there are. You'll have more information about the genes if you want to read about it. And you will see every person is different. But in the end, we want to just see how much it impacts the process. So moving on to methylation in fertility in men. So I think that's the other thing we often think about in females. But this is a picture of a study in 2020, and this was it was a systematic review about paternal folate status and methylation and its influence on sperm quality and also pregnancy outcomes. So it's not just about falling pregnant, but also the quality of the outcomes of the pregnancy. So they concluded that there are definite associations between paternal folate status, which obviously will then also go back to what's going on in their methylation pathway, and that is also associated with congenital malformations. And I thought it was quite interesting because often we think about what's going on with the female, but it can also be the sperm. Right, so those were the cellular pathways. This is a picture of all the pathways in our test that are more systemic, and you'll see they sort of also get numbered from 1 to 7 over here, which are systemic pathways, and we also have cardiovascular pathways. So all of these pathways, every one of them will be important for you. And again, you will focus on the ones where you have more impact. So if we look at things like mood and behavior, these are your neurochemical balance, memory and brain health, maybe to a lesser extent. Then histamine plays a role in hormone balance. Of course, hormone balance, I will show you a bit more about that. Glucose insulin regulation, and also thinking of connective tissue, both soft tissue, your collagen and joints, which is impacted by pregnancy, and bone health, so vitamin D, calcium absorption, and so on, also really important for a healthy pregnancy. And then our vascular health pathways, and particularly thinking about blood clotting. So I'm going to talk a little bit more about our hormone balance pathway. So this is again, I know these are all very busy, but I will sort of try and go through it with you. So all of these are the gene variants that we test, and this is the whole steroid pathway. And when it comes to females, the first thing that comes to mind would be your estrogen and progesterone levels. And we know, again, like I said earlier, that your elevated estrogen may shorten implantation windows. The uterus can become refractory and in high doses of estrogen with high doses, and then that doesn't support the implantation. So that's where estrogen dominance play a role. But then also if there's imbalances between estrogen and progesterone, it can contribute to issues with the implantation. And of course, you can measure this. There's lots of tests out there, but doing the genetics will really help you to see where you can focus. So in my number one here, for instance, if you have the CYP17A1 and CYP1B1 SNPs in our report, that might be that you have higher levels of cortisol, which can then impact the pathway there and also lead to higher levels of estrogen. Then if we look at inflammation and also your aromatase enzyme, that will also increase estrogen, and the detoxification genes will impact the estrogen levels further and also influence the endocrine disruptors. And then lastly, we also think about, sorry, let me just go back there, get it on here. So thinking about ovulation, androgen, and glucose insulin regulation. So again, glucose and insulin impacts your hormone balance, and if this gene is present, CYP17A1, it will impact it further. Over here as well, the aromatase and inflammation gene playing a role. And then with methylation, the histamine over here in the bottom, that would also impact the estrogen and progesterone levels. So like I said, this pathway and knowing what the SNPs are in the pathway will help you to see in which area you want to focus. This is just also a interesting SNP in our report is the estrogen receptor beta, ESR2. And there's quite a lot of studies around this receptor, which we've added now to our report recently. And when you have the ESR2 SNP, if you have the AA or GA variants, that's associated with reduced expression of these receptors and associated with poor fertility and endometriosis, PCO, and also actually migraines. So, for instance, if you see the ESR2 SNP, some aromatase enhancing supplements, for instance, might be something that you can use. And then just sort of throwing this in here. So, of course, when you do genetic testing, the next step would be to do more targeted testing. So this is the Dutch test cycle mapping, which you can then see to track this estradiol and progesterone levels. And that will also be something you can then tie back to the steroid pathway. Then if we use the same graphic and we think about male fertility, so estrogen, testosterone, as well as DHA will affect the sperm. So that's where you can look at this report again at the SNPs. Your luteinizing hormone stimulates the testes to produce testosterone, and then FSH stimulates sperm production. So if there's low testosterone, you could, for instance, have a SNP in your 17A1, and that will be associated with DHEA and androstenedione synthesis. And the other SNP that we measure, we have two SNPs in the sex hormone binding globulin gene, and the SNPs are either associated with the affinity of testosterone to these proteins, or it can be associated with increased levels of sex hormone binding globulin. And that's also quite important because when you measure testosterone for the patient, and sometimes the testosterone level is not a true reflection because of this sex hormone binding globulin, and measuring this will give you a better picture. Then we also have the 5-alpha reductase gene, and that causes high DHT levels, and that will impact sperm production. Then for men also, estrogen will also play a role. So in the past, they thought that high estrogen levels are detrimental, but it's probably more associated with what's going on with the aromatase enzyme. But estrogen is produced in the testes, and it plays a role in male reproduction. Your estrogen receptors and aromatase receptors, or aromatase enzymes, is important for making sperm. Estrogen is also important to help the sperm grow. And we also know that the estrogen levels is associated with libido. And this is again just the estrogen receptor 2 that I spoke about with females. There are some studies that show that the estrogen receptor will impact male fertility, And for the same reason as estrogen is important for the whole process, if you have less of these receptors, estrogen activity will be impacted. So once you've done the genetics, this is in our clinical guide, which you will find helpful when you sign up for testing using our test. And we will then also guide you, although you can also find this in other places, on the type of information that will speak to specific gene variants in blood tests and also some of your organic acid testing. Right, so that was the hormone pathway. Then there's the mood and behavior pathway. So in our mood and behavior pathway, we include genes that impact the manufacture of neurochemicals, the utilization as well as the breakdown, and also inflammation, cytokines, and also how it would, and that will then also be something that you can think about in terms of the gut-brain axis. So I'm not going to talk too much about this, as this is a lot of information, but really just to think about neurochemical balance and specific ones that might impact the whole pregnancy experience. And here we think about things, your neurochemicals like serotonin and oxytocin. So we know oxytocin is really important for bonding and for the maternal health or the parents bonding with the baby. So this is our whole a great pathway to dig into to see where the genetic variants are. And if we, again, think about oxytocin, this was a really great study looking at how the amount of oxytocin impacts the behavior of postpartum depression, number one, and also the sort of behavioral problems that you sometimes see in the babies later. So the gene that we measure is the oxytocin receptor gene. And this was a study where they looked at the interaction of the SNP and maternal postpartum depression and child behavior problems. And the conclusion was that it does impact it quite significantly if you have specifically if you have two alleles of this gene variant, which means that there's a reduced sensitivity of the receptors to oxytocin. So this is a good example where your gene plus your environment can then predispose the infant to behavioral problems, but we also know that it's something you can think about for postpartum depression. And there are many ways to increase oxytocin or to support the oxytocin balance. I've just listed a few here. Even the things like essential oils, really great if you use it for some sort of process or treatment for massages and things like that. So sunlight, vitamin D, and so on, supporting oxytocin. So oxytocin also impacts the HBR axis. And so when you have this oxytocin SNP, it helps to calm the HBR axis. So it's got a calming effect because it helps to reduce the effect of cortisol. And so again, these oxytocin receptors will impact the ability to decrease the anxiety. Right, so that was the mood pathway. Okay, moving on to insulin resistance. We know that insulin resistance will lead to problems like increased luteinizing hormone or decreased FSH. And so in men, when there's insulin resistance, you will find that you could have things like erectile dysfunction. And in women, it's associated with PCOS, either increasing the risk, or when there is PCOS and there's a lot of genes in the insulin pathway resistance, and it's also associated with gestational diabetes and, of course, increased oxidative stress and inflammation, which can then also cause more problems. This is a picture of all the genes in our glucose insulin pathway. And again, we sort of give quite a bit of information about every gene and describe the pathway. But in one of the interesting genes in this pathway is the melatonin receptor 1B, and that influences it encodes, again, a receptor for melatonin. And there's a lot of information out there at the moment about melatonin and how it influences the release of hormones that are essential for reproduction. And it's quite interesting with a lot of light pollution and the way we live with our circadian rhythms being interrupted, that the reduced amount of melatonin availability impacting fertility levels. But this SNP has been shown to, because there's this upregulation of these receptors, it impacts the glucose-induced insulin secretion, and that can then lead to insulin resistance and also glucose dysregulation. So there were quite a few studies, and I've listed them at the bottom here, that found that this specific gene variant is associated with polycystic ovarian syndrome as well as gestational diabetes. So when somebody has a SNP, looking after the circadian rhythm, but also looking at switching off melatonin in the morning, avoiding blue light at night. I've actually got these information here, and maybe having a later breakfast to help with regulating insulin. Okay, moving on to histamine. So the hormone-histamine connection, we know that histamine stimulates the ovaries to make estrogen, and then estrogen down-regulates the DAO production, and then these uncleared histamine stimulates estrogen production again, and then estrogen stimulates mast cells to release histamine. So this is an ongoing process, but in pregnancy, histamine breakdown is essential, and the placenta actually produces more DIO than any other human tissue. So if there's elevated placental DIO, and this is one of the genes we test. There's 2 SNPs that we test for. So when there's high histamine, it can be associated with preeclampsia, of course, extreme morning sickness, and also can increase the risk for miscarriage or growth retardation. So one of the things to remember is with pregnancy is not to use antihistamines, because the histamine is important for the whole process, and to rather look at how you can upregulate these enzymes and help with the degradation of histamine, thinking about things like vitamin B6 or vitamin C, which helps with the breakdown. Right, so that was, I'm not going to go too much into the connective tissue pathways because of time, but I want to move on to the vascular health pathways, and this is just a picture to show all the different parts of the vascular health that we consider when we think about vascular health. But in fertility, the increased risk for developing DVTs is, of course, important. There's some genetic factors. So women with a factor 5, which is the factor 5 Leiden over here, that's associated with increased fibrinogen formation and an increased risk for clotting. They have been shown to be 2 to 3 times more likely to have miscarriages and other complications. Of course, it can be treated if you know about it. So, and also, it's not about females only. The men who have factor 5 can also impact pregnancy outcome, because, of course, the infant can inherit that gene. I just added this article. There's some of the tests that I've seen out there in the market that talks about ApoE, but specifically the E2 gene variant, which we see as beneficial normally in our test, that some of these tests say that it's associated with poor pregnancy outcomes. But this was a great study which was done recently to show that it's not linked to a poor pregnancy outcome. And then blood pressure. So we have a great blood pressure pathway, and these are all the genes in purple that's in your renin, angiotensin, aldosterone system. And when we think of pregnancy, what happens when the estrogen levels increase, it induces the production of angiotensinogen, and then the AGT gene that we test could then further increase its levels. And then the corpus luteum and placenta will release prorenin and renin. Again, if there's a SNP, there's an increased production of renin, and the renin converts angiotensinogen into angiotensin 1. So if you have an ACE gene, specifically called the ACE-DD, where there's a part of the gene that's deleted, that will then increase the vasoconstriction. So the net result of this estrogen-induced angiotensinogen is this increased blood pressure and also the blood volume. And so knowing these genes will be great to know if there's possibly a problem with the blood pressure going too high. Then weight management, of course, that's an important part of pregnancy. So we've got this part of our test where you can see how the genes impact different parts of weight management. So appetite, fat storage, expenditure of energy, as well as how easy it is to lose weight. And of course, with females, you might even want to use the test before they fall pregnant, because we know that there's so many reasons that weight can impact fertility, including things like insulin resistance. Increased levels of leptin is going to be impacted, as well as sex hormone binding globulin. So all of these are impacted by being overweight, and a lot of these genes are part of our test, including these adipokines, which causes extra inflammation. So some people are more prone to inflammation when they're overweight. And of course, with men, the increased obesity also leading to high insulin levels, low levels of sex hormone binding globulin. You also can have this increased aromatase activity and the inflammation causing oxidative stress. And again, the adipokines and the increased levels of leptin. And this is also, we have these genetic variants, the leptin receptors, that predisposes these patients to higher levels of leptin. Then exercise. So there's an exercise session, and we know we want a healthy pregnancy outcome. And these are just things that we can also consider if during the pregnancy, there's exercise, making sure that you prevent things like injuries and support recovery. Then lastly, it's our nutrient section. So in the nutrient pathways, there are so many things that we can consider. The iron overload. So iron overload plays a role in infertility because it causes oxidative stress. Our fatty acid pathway, important for brain and eye development, and this is also going to help to see the types of fats and how important it is to, for instance, take some marine sources. And they are all also impacted by oral contraceptives, and so these genes will indicate that you might have an increased demand. And then also our gluten pathway, which is associated with a predisposition to celiac disease, and then vitamin D. So the vitamin D requirements are important, and some of the SNPs we test, which are the vitamin D receptors, are associated with low birth weight. So I just wanted to, again, talk about choline. So we test these 4 genes in the choline pathway, which can show the demand for the amount of choline that you need from the diet. And during pregnancy, choline is important for fetal brain development. It helps to decrease birth defects and also the maternal placental health, and of course plays an important role in your methylation pathway because it acts as a methyl donor in your salvage pathway and can help reduce the potential for things like neural tube defects. And this is just another reminder of how iron overload can be really detrimental for and cause infertility, things like erectile dysfunction, and also the oxidative stress that damages the sperm. And also, so you'll see it more in men than in females. But if somebody has the high impact genes, which is the HFE gene, you can also sometimes see it in females. And then this is the fatty acid pathway. So we test the fatty acid dismutase genes. So these are the ones that break the double bonds, and also the elongation genes. So if you have SNPs in your elongation genes, the amount of DHA that you need in at the end of this pathway is significantly increased, and again very important for brain development and eye health in the baby. Right, so this was basically what we went through. Now we have the whole genetic test, and then I explained how all these pathways would impact different variations. So preventing pregnancy complications, all these red areas here are the ones that we want to focus on for the prevention. For mental resilience, we have our brain pathways, and for physical resilience, we have our connective tissue pathways. Hormone balance, important, and together with histamine overload, which could impact each other. And then the need for specific nutrients, which are listed here. And of course, body composition optimization, and making sure that I didn't put the exercise page here, but that's also something that you can look at. And so what I've done is I have put this table together, and I'm not going to go through it now because we want time for questions, but I just wanted to show you blowing it up a bit here. So what I've done is for each of these pathways, so these are all the pathways. I have highlighted the specific genes in the pathways. You always consider the whole pathway, but I've highlighted the specific genes in the pathways that are specifically being talked about in terms of fertility. And then I have divided into how it impacts the female. So for instance, I've got methylation here, which will impact hormone balance, stress regulation, mental health, and also histamine breakdown. In men, it will impact sperm quality, the hormone balance, detox, also histamine breakdown, how it will influence the influence on fetal health, so the placental, neural tube defects, and so on, so the type of things that can go wrong. And then I have put the recommendations in the last column. So here, just highlighting the type of nutrients and food sources and things that you can consider. So I have done that for every pathway, and I know you will have access to this presentation. And at the end also, if you're really interested, because I wanted to reference it well, so that if you want to read more about it, especially if you have a test result and some of these pathways have high impact, you can go and read some of these references.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.